Hello everyone, welcome back to my channel. Today I'm going to continue the conversation about my master's project and what I did. Today I'm going to talk about the literature review. So literature review is when you read all of the literature around this topic and you kind of want to see where the gaps are, the academic gaps regarding the topic. I gathered a lot of information. I just want to kind of explain that the way that I went about looking at all of this information, because if you think about it, you're reading and kind of looking at the whole academic world. Even though it's a specific topic, it's still kind of overwhelming and a lot. For me, I kind of slowly started to make themes or topics out of what I was learning and what I was finding out. So first I'm going to have a menstrual health and hygiene kind of general context section. And then we're going to go into menstruation, menstrual health and hygiene in the Colombian context. And then from that, we're going to go into the Colombian policy environment regarding menstrual health and hygiene management. So policy meaning government policy. After that, I'm going to touch on monitoring, evaluation, and learning. And so if you saw my last video, I talked about MEL, which is monitoring, evaluation, and learning. Some people talk about it as M&E, and some people use the acronym MEAL, monitoring, evaluation, accountability, and learning. So yeah, I'll talk about that topic, and then we'll go into the intersection between menstrual health and hygiene management and monitoring, evaluation, and learning, and the intersection. And then finally, we're going to talk a little bit about feminist theory and the word empowerment, okay? So let's see if we can make this video short and sweet, but still with all the information that it warrants and that is needed. So first, I kind of want to talk about how I gathered all this information. So the way that you go about literature reviews is that you start researching, you start going on the websites, either on Google Scholar, your university's library resource or library database. And then from that, after using those search engines and databases, you kind of start to get more information that then maybe you read an article that has a lot of sources, and then you look at those sources and then find more articles, and that's called the snowball method or snowball technique, where it kind of starts to build up on each other. Keywords that I used was MEL, M&E, monitoring and evaluation, menstrual health, menstrual education, menstrual health and hygiene, Colombia, Latin America, girls and women, girls empowerment, M&E capacity assessment, and MEL capacity assessment. That's kind of my my strategy. That's kind of how I went about this. So for the literature that I found that I thought was important regarding menstrual health and hygiene in the general context, I found something from Sommer and Sahin 2013 that defines menstrual health and hygiene management as the use of clean menstrual management material to absorb and collect blood that can be changed in privacy as often as necessary for the duration of the menstruation period, using soap and water for washing the body as required, and having access to facilities to dispose of used menstrual management materials. So that's a lot, but it's a lot for a reason. The definition is trying to capture as much as it can so that when the menstruator cannot manage their menstruation according to this definition, then it comes out of those bounds. And then that's when we talk about inadequate menstrual hygiene management. For example, in this definition, there's talk about being able to have soap and water. So a lot of girls around the world do not have soap and water. Maybe they have soap, but they don't have water. Or they have to gather water. They have to walk for a long time, 2 hours, to go to a nearby water source to then have water. So when a woman or a girl doesn't have soap and water, that is inadequate menstrual health and hygiene management. It is out of their reach. You know, it's not because of their fault. It's kind of this situation that they find themselves in, but then that translates into inadequate menstrual health and hygiene management. Another example is the access to facilities, private facilities. So many people, many women and girls around the world do not have a private bathroom in their school. So when that happens, then they are not in this definition, and then it becomes inadequate menstrual and hygiene management. Again, it's not their fault, it's just kind of the situation that they're in, but then we can then define that person as not being able to adequately take care of their menstruation. So that's why that definition is so big, because it's trying to capture as much as it can. However, there is an added part of this definition that is not here by Summer and Sahin. So Sood et al. 2022 suggests including living free of the social norms and taboos that hinder access and use, and limit knowledge and empowerment. So again, another example with this definition is that if there's a girl that is menstruating, but they have all these taboos around this situation, this part of the life that happens every month, then they are not living free of these taboos. They are not free of this social norms, and then that becomes an inadequate practice. And so I suggest to combine these two definitions to make it more holistic. So that's kind of the very beginning, and that took a lot, but I thought that was important to talk about. To form a holistic definition, we need to have these two definitions together. Okay, so continuing on. So then we want to go into the Colombian context, because my project was focused in Colombia. I found from UNICEF, a study from UNICEF in 2018 found that girls and adolescents are experiencing their menarche without any previous information about menstruation. So that means that 35% of the girls that were surveyed did not know anything about menstruation before it happened to them. And then 45% of those surveyed did not know or did not respond to a survey when asked where their blood comes from, their menstruation blood comes from. They didn't know. So this information reaffirms the need to have improved access to health education. So I had mentioned in the other video that Colombian girls are experiencing their menarche at an earlier age, and that can lead to an increased risk for early childhood and teen pregnancy, gender violence, child marriage, and early unions, and school dropouts. And so we can see that there's a huge need for comprehensive menstrual education and increased knowledge of life skills that could provide tools and information for girls to be prepared for these changes that come with menstruation. Other things to kind of take a note of, menarche and menstruation are typically sometimes talked about in a biological kind of lens. So you have this menstruation, that means that you can get pregnant. That's what I mean when I say a biological lens. But there's also a lot of social aspects to menstruation. For example, an end of playtime. So now girls stop being children and girls and now ending playtime. And so also they have to be careful with themselves to not stain themselves while doing activities. There's an increase in home chores and economic activities, for example, to pay for their own things. And there's an increase in vigilance of their relationship with or activities around boys to prevent poor social reputation and or early pregnancy. And this is all coming from UNICEF Colombia 2018. So a lot of these experiences often lead to negative connotations around menstruation. At this time in a girl's life, this might be an encouraging way to self-exclude themselves out of extracurricular activities and avoid being around boys. Okay, so that's kind of the Colombian context. There's so much more to talk about, but now I'm gonna go into the Colombian policy environment regarding menstrual health and hygiene management. So throughout the years, there's been many policies in Colombia that have been introduced to support women's health. Okay, there was a really important comprehensive policy that was introduced in 1992 called Health for Women, Women for Health. And the objective of this policy was to define mechanisms that would make Colombian health systems more responsive to the needs of women's health. So this policy included five program areas. So promotion of women's health and self-care, prevention of abuse and attention to women victims of violence, women's mental health, occupational health, and reproductive health and sexuality. So this policy was very important because it focused and it acknowledged women's health beyond the reproductive realm. Unfortunately, this policy did not get signed into law, so it just kind of was at the mercy of the governments as Colombia changed governments. And so as the author Plata from 1995 puts it, a policy is not enough, and women's health policies should be implemented in systematic and sustainable ways. Otherwise, as she puts it, the policy is nothing more than an interesting and rare government document with a gender perspective. So that was one really important policy that nothing happened with it. But then if we fast forward, there have been bills introduced lately. So in 2021, there was a bill introduced that actually was signed into law of January 2025, which granted girls and women one excused absence during menstruation from school and work without any negative repercussions. So one thing to note is that even though these bills have been passed into law, there's still a lot of things that have to happen to interpret that law. There's conversations around what does this look like, who gets to use this license, this menstrual license? Is it just women that work in government, etc.? So even though the law has been passed, the way that it's interpreted could change and could vary. Another interesting law that was approved by Congress in 2023 was a law that would create awareness campaign, early diagnosis and treatment of endometriosis. So this is a law that focuses on women's health. And so even though there's all of these great policies that have been introduced or that are being introduced, it's still important to note that menstrual health should be part of legislation. Studies suggest that menstrual education should be considered a human right issue, and efforts from various sectors, so from government, community-based organizations, and nonprofit organizations need to come together in a holistic manner to really address the need that is needed for this topic. So I have laid out kind of a general policy context in Colombia. So now I'm going to talk a little bit about monitoring, evaluation, and learning. So M&E or MEL is a field that helps people understand what is working and what could be improved in projects. So at the basic level, evaluating our efforts is common sense practice that helps people ensure if a service is sufficiently meeting the needs of those it serves. So is a project doing what it needs to be doing? Is it fulfilling the need? Is it working for the people that it's serving? How can we tell? Well, we need to do M&E, monitoring and evaluation. So M&E works by collecting and summarizing evidence that then leads to conclusions about the value, the merit, the significance, or quality of an effort. So kind of with that quick context of monitoring and evaluation, now I'm going to do the intersection of menstrual health and hygiene and monitoring, evaluation, and learning. So this is where I get really excited because there's a lot of really great information about monitoring, evaluation, and learning, or MEL, and how it's being used to and how it's effectively being used in menstrual health and hygiene interventions. So there's a lot of positive indicators that there are really effective menstrual health and management interventions around the world. However, there is insufficient evidence to really say that the interventions and the workshops are doing something. So there's a big need to really understand what type of interventions have been done for menstrual health and hygiene management, and what tools have been used, and what data has that given us. So this will then help inform what is working and what is not working. So there is a lot of data of the projects that have been used in the reporting and evaluating of those projects. However, it's kind of all haphazard. So they're kind of, when you read a document that says, we did this menstrual education intervention and these are the results, that document has definitions of menstrual health education. And if we look at a different document from a different intervention, that document has a different definition of menstrual health education. So then we have these two documents that talk about an intervention, a project, and they give us all this great information, but the definitions are different. So then when you are comparing them, it's hard to compare because they're using different concepts, different definitions, and maybe they're using two words that might actually mean the same. So that's what I mean when I say there is a need for kind of a standardized concept and understanding of menstrual health and hygiene and all of the related concepts, so that we can take all of these workshops and all of these evaluation reports and be able to compare. From other journals that I found, authors explain that standardizing a core set of practices to assess the interventions would be really valuable. And again, et al. From 2020, where they said our audits reveal that practices measured across studies have been highly inconsistent and seemingly haphazard. So there's an encouragement to improve consistency on the operations of male practices, such as reporting and including the core concepts and questions used so that readers can compare findings across studies. Consistent and core concepts across the board, across the world, so that when a reader picks up a report, they really can compare it with other findings from another report. I think that's the biggest problem, and that's what I found. For example, there was a lot of reports that I read where they would say menstrual health and hygiene management, and then other reports will just say menstrual health management. And they were saying the same thing. They were talking about the same topics, but they were using different concepts. And when you're trying to be scientific, academic, these details are very important. It's very important to keep the same concepts across the world so that you can really compare easily and make better assumptions, have a better understanding. Menstrual health and hygiene management definition should be adopted by all developmental domains so that a comprehensive human rights approach can be employed, encouraging multiple sectors to work together. So for example, if a health sector wants to work alongside a economic sector to come together and work on menstrual health and hygiene management, so if they want to come together, there needs to be comprehensive core concepts that all the sectors can use to kind of really focus and be on the same page. A good example is kind of the definition that I gave earlier, where I took two definitions from two authors and put them together. This is a definition that can be adopted by everyone, wherever they are in the world. When we're talking about menstrual health and hygiene management, we are always using the same definition, and then we can really look at what's missing and if it becomes an inadequate or adequate menstrual hygiene management. And there could be benchmarks, a set of standard concepts and to jump off from. So now we will move into the feminist theory and empowerment section of my literature review. So I wanted to kind of think through, or at least look at what feminist theory talked about. I didn't really find much information on feminist theory regarding menstrual health education, but I did find some interesting information. It's important to know that social dynamics situate girls in society within a social class, or racial and ethnic groups, and within patriarchy. So there is an inherent power dynamic of age, of class differences that play in either the classroom or the workshop setting. So we have to think about this when we are looking at menstrual health education workshops. There are these dynamics at play. I also wanted to look at the word empowerment because we hear it a lot, specifically with youth empowerment workshops, etc. The term empowerment requires three conditions: an agent of empowerment, a notion of power as property, and some kind of vision or desirable end state. So these three conditions are problematic because first, an agent of empowerment must have some special ability that they will give to the student. However, this ignores the context of the social constraints in which both the empowered and the person who is to be empowered live in, such as patriarchal institutions. Okay? Secondly, empowerment is seen as something that one possesses as property and can give to the other. The author state that instead, empowerment is something that is exercised. They quote, "Exercising of power is an attempt to help others exercise their power." So lastly, empowerment is seen as a desirable end state of freedom, but the authors argue that empowerment doesn't free. Instead, it only challenges the status quo and keeps people in the dichotomy of powerful and powerless, or dominant and subordinate. Instead, empowerment should really be about actors negotiating within particular context. Additionally, Luke and Gore explained that the teacher doing a workshop, empowering the student, must examine their own implication in the conditions that they seek to affect. So they should look at themselves in this context where they are trying to affect change to the student or to the least empowered. So with this information, I wanted to kind of take empowerment out of this very positive context that we have it in and kind of be a little bit more critical about it and think about empowerment differently and how it is applied and the problems of how it is applied. And one last thing with empowerment is that Kabir from 1999 has a very great definition of empowerment. She says empowerment is the process by which those who have been denied the ability to make strategic life choices acquire such an ability. So in this definition, the author states that three interrelated dimensions help measuring empowerment. And measuring, again, we're talking about monitoring and evaluation of a workshop where you're going to empower the student. So these three dimensions are resources, agency, and achievements. And these three concepts cannot be divided or isolated. They need to be looked at together when measuring empowerment. So yeah, I think for now, this is where I will stop with my literature review. This is where I ended it. If you want to read it, if you want to look at the document and read it for yourself, it's linked in the description box. But yeah, I hope this was interesting and not too confusing. So thank you, and I will see you in the next episode.